Hello, FACES students and FACES community. This is Dr. Magaña, Director of the FACES for the Future Coalition, and I'm here to address questions from our students with regard to the COVID vaccine. First off, I just want to extend my deepest appreciation and really respect for all of you who are doing such incredible work in our community to educate them about the importance of the COVID vaccine, and how it prevents the ongoing spread of the virus and contributes to our ongoing pandemic. You guys are doing extraordinary work out there, and I just want to applaud all of you for your efforts and your contributions to this really important effort. So as many of you have heard, I am making myself available to answer any questions that our FACES students might have with regard to the COVID vaccine that have come up. And I was made aware that we received our first question from one of our FACES students based in San Diego at Crawford High School. Specifically, and I hope I'm saying her name correctly, Noseba Suleiman, who asked the really important question, does the COVID vaccine cause blood clots? And some of you may have actually heard this through the grapevine or in talking with community members. And I think it's an important question to ask and a really important question to address. So I'm here to provide some very fundamental and basic information about whether or not the COVID vaccine has caused blood clots in certain patients. And the answer to that is this. There are reported cases of blood clots happening in a very, very small number of patients associated primarily with the J&J or Johnson & Johnson vaccine. So as you all may be aware, the J&J vaccine was made available in April of 2021 to protect community members against COVID. After its administration, there were very few cases of a very rare side effect called thrombosis, which is really an event where there are small blood clots which can form either in the leg or in the lungs, and they can be life-threatening. But this is the reality. They stopped administering the COVID vaccine, the J&J vaccine, for a very short period of time to do more research and study on this. And what they found is that this is an extremely, extremely rare event. So as of November 2021, which is last month, there have only been 54 reported cases of blood clots in patients who have received the J&J vaccine out of 16 million people who have received the J&J vaccine. So as you can imagine, right, 54 out of 16 million, the chances of anybody developing this are extremely, extremely rare and extremely minimal. And because there is such a low risk, the CDC, the Center for Disease Control, and the FDA approved the J&J vaccine to be administered again. So we continue to do that. So the chances of you developing a blood clot from J&J are very minimal. But of course, it's something that communities should be aware of just in case for those who do receive it. And some of the symptoms that might be associated with that may be shortness of breath, chest pain, pain in the leg, all of which could be indications potentially of a blood clot. So if there are concerns that community members have or your family members have, it's important to discuss those concerns with a doctor or a healthcare professional in your region, in your neighborhood. Now, they also checked out the other vaccines, specifically the Moderna and the Pfizer, and what they found is that out of 437 million doses or people being vaccinated with Moderna, there were only 2 reported cases of blood clots happening in that population. So they felt, given that there were so few, that really there is no risk with regard to the Moderna and blood clots. And with regard to the Pfizer, as far as I know, there have been no cases of blood clots with regard to the Pfizer vaccine itself. So all in all, and in summary, yes, there is a very, 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 very rare risk of blood clots occurring with the J&J, but that does not outweigh the tremendous benefits that the J&J, Johnson & Johnson vaccine, Moderna, and the Pfizer vaccines provide in terms of protecting our community against severe COVID infections and disease. So I hope that addresses that particular concern. If you would like some additional information about this in particular, I encourage you guys all to read the website from the CDC, the Center for Disease Control, which has tons of information about this and other possible side effects related to the vaccines. Keep the questions coming. I want to make sure that you guys are empowered to have the necessary information, and I welcome any and all questions. There is no stupid question with regard to this. Once again, thank you all for your wonderful work in educating and encouraging our communities to get the vaccine so that we can hopefully halt on the progression of this virus in our communities. Much thanks to all of you. Happy holidays. Bye-bye.